We're here with Raj Desai, FACC, and partner with Pima Heart and Vascular. He also sits on the U.S. Heart and Vascular Executive Leadership Board. Dr. Desai, please share with us why Pima Heart and Vascular decided to partner with U.S. Heart and Vascular.
You know, that's a great question, Brooke. And I can tell you initially, when we first started going through all this, when you start reading articles about private equity, there is a lot of articles out there that say that private equity just drives up the cost of care. All they care about is getting patients in the door, running tests on them, maybe sometimes unnecessary tests, driving up the costs, and that is not good for the healthcare system. We didn't quite look at it that way. We, as a group, already offered all of the ancillaries and all of the patient care tools that most cardiology practices have, and then some on top of that. We started thinking about what is the next level that we could go to where we could take our cardiology practice. And part of that involved optimizing patient outcomes as well as lowering the cost of patient care. And so when we talk about that, you also have to talk about how could joining private equity help lower the cost of cardiovascular care. And the way we envision that is there are a lot of groups out there that don't necessarily have the financial backing to do some of the things that we did. So for example, in our model, we were able to open up our own ambulatory surgical center, which, as everybody knows, is actually cheaper than doing procedures on patients within the hospital where they charge HOPD rates. And so it's rare in the practice of medicine where you can actually optimize patient outcomes, have a better patient quality of experience, and at the same time lower the cost of care. But that's exactly what we were doing with our ambulatory surgical center. And so our vision was, hey, if we could take this model and we could help go across the country and help empower other groups to kind of do some of the same things we were doing, optimize patient care, lower the cost of care, help provide these groups financial backing so that they could put up some of these ancillary services, put up these ambulatory surgical centers, put up these vein centers, put up some of the other outpatient diagnostic testing that we do, where if patients went and did that in the hospital would be much costlier. And we were able to do it at better rates. That was our vision for moving forward with this partnership. And we're already seeing it now come to fruition in the Houston market and some of the other markets where we have ambulatory surgical centers going up. And our hope is to continue to help, lower the cost of care as our group continues to expand and as U.S. Heart and Vascular continues to expand.
Dr. Desai, what is a differentiator that Pima Heart and Vascular offers Tucson and our southern Arizona communities?
Well, I think one of the big differentiators you're seeing today here at this event, we sponsored CVIS for all of Arizona. Great turnout today. Congratulations to the guys who helped put this on.